Myanmar is a small developing country located in East Asia Pacific. It has a population of 53.9 million and it has many health-related issues that need to be addressed. By looking at burden of disease and important public health issues, we can create action plans that will result in overall better health for the citizens of Myanmar.
The burden of disease is measured through financial costs, mortality, morbidity, and other indicators. Two forms of measuring the burden of disease in this report will be the disability-adjusted life years, which measures the health loss due to illness, disability, or premature death in a population. The burden of disease is divided into three components: communicable, non-communicable, and injuries. The least amount of DALYs from the three injuries makes a total of 2,145.6 years lost in Myanmar. Number one cause had been unintentional injuries, with 30.9 years lost. The second least amount of DALYs in Myanmar is communicable disease. Communicable diseases are infectious disease transmitted directly or indirectly from people to people, animal to animal, or animal to people. There has been a total of 6,818.1 years lost. An example of communicable disease is tuberculosis, which is also a number one leading cause of years lost, of 26.1. The last component, non-communicable disease, has the greatest amount of years lost due to illness or disabilities throughout Myanmar. Opposite to communicable disease, non-communicable diseases are diseases which are non-infectious. Non-communicable diseases has a number of 12,822.4 years lost, and cardiovascular being the highest cause. There are three central public health issues which urgently need to be targeted in Myanmar. These three public health issues are lack of education among the overall population, nutritional issues predominantly focused on mothers and their children, as well as lack of access to health services for those who are unable to financially support private health aid. Educating the citizens of Myanmar has positive outcomes, especially in health. As majority of the population in Myanmar does not have enough education, their knowledge about the current disease are restrained. However, an issue that comes between educating the people in Myanmar is their language diversity. Limited number of resources decrease their admission rates, while increasing student dropout rates. These rates are caused by the distance and individuals may be required to travel if they are not by the school. Nutritional issues is one of the three public health issues that were chosen for Myanmar. Malnutrition plays a large role in the spread of disease and the number of deaths that take place. The lack of adequate vitamins and minerals in the diets of people, especially the children of Myanmar, has resulted in malnutrition. One of the reasons for Myanmar nutritional issues is lack of access to water. The villages located by ocean or near rivers have much better access to water, whereas those who are located in central Myanmar have limited water resources. As a solution, we found that bus services that collect water from the main water sources, such as rivers and oceans, will be the most beneficial. Not only would the water supply help from people's nutrition health, but it also provide water for growth for crops. A current ongoing issue in Myanmar is the healthcare system and services provided. There is a lack of access to healthcare services in the country due to a high number of private institutions compared to public institutions available, such as hospitals and clinics. If the country were to provide many more public facilities to the public, it will become a lot more accessible and much more affordable for those that are unable to afford the cost of private hospitals and clinics, which is much of the population of Myanmar. As part of our action plan, if we were to convert some of the existing private facilities into publicly funded buildings, then there would be money saved by not having to construct brand new buildings or provide brand new equipment to use. Publicly accessible clinics will also provide for better accessibility to vaccinations and treatment services throughout the entire country to prevent the spread of diseases.
By focusing on specific common and deadly diseases within this country, the public health issues and risk factors become clear. Educating the people in hygiene and cleanliness, increasing access to water throughout the country, and building more public hospitals will swiftly solve educational, nutritional, and health service distribution issues within Myanmar.